Hello. So I want to talk about in this video the patient services and what I know this is not the right terminology for this, but what I'm trying to refer to is what actually happened while I was in the rooms, basically the two rooms that I was in during the day of the lumbar puncture. And basically it's the sort of well, I was actually in three rooms, but the two bigger rooms. So the first room, I was with a nurse, and this is the preparatory room. So it was the pre and the post. And so at that time, she came in, she registered me, she did a questionnaire of asking me the typical questions of what medication I'm in. And this was not the check-in. In the check-in, they weigh you, they measure your height and all those things. I'm talking about past the check-in protocol. Once you're in the room, then she did another blood test. She also did. She actually asked about an IV. Most times, patients are actually put a small IV somewhere. They're hooked up to. They're not hooked up to an IV, but they do the port for an IV. I do not need it on a normal basis because this particular interventional radiologist knows me so well, and I don't require to be. I've never required an IB for any reason, so usually they do not do it. Plus, I am a very hard stick, honestly. Even for the blood tests, they usually require them to call the special team for blood tests and blah blah blah, because I'm so dry and everything else. So usually we fortunately can avoid that step. It doesn't mean they always avoid it, and it doesn't mean that I'm not usually there sitting with tears rolling down my face while they stick me in 5 different places. I'm sure some of you can relate. But hey, it is what it is. So it went very smoothly. She asked me the whole protocol of questions that needed to be asked. There were a set of additional questions because of the COVID pandemic, which I totally respected and understood. And then I was wheeled down by transport. All transports personnel were absolutely wonderful. They all had a mask on. They were very convivial in that they were friendly, and they were also they treated me very well in the sense of they were not banging the stretcher around or throwing things around. They were not in a bad mood. You could tell they were concerned to be there, so they wanted to be safe, and they were managing things quite well. Then the welcoming nurse for the interventional radiologist was very kind, very nice. And at that point, just as a side note, I had to go to the ladies' room, and she walked me. She helped me because I have a very difficult time with falling. So unfortunately, it's one of the issues with my intracranial pressures that I fall a lot. So she helped me. So there were many times where things, or I should say, personnel could have been a little rough with me, and they were all extremely kind. The doctor was, even though I do have a rapport with him, so I know him, but he was extra. He went the extra mile because I was asking him questions about the COVID. I was wanting to know if I was really safe there, and he reassured me. There was actually one point where he was telling me stories, and it was a bit jarring, but it was also very positive in that he was telling me how everybody had taken care to make sure that it was a safe experience. So that was very, and I keep using the word very, but that is honestly how I feel from the heart, but also how I feel thinking about the whole procedure. And I keep going down all the steps one by one. And I can see how there was a protocol being followed behind the scenes. It's one of those things where you see things happening, you don't verbalize them, but you see things happening, and you sort of take note. You take note of this person went and used sanitizer at this hand, this person at this time, this person went and changed gloves at this time, this person. And then I'm lucky enough that I always ask the interventional radiologist or anybody working on me, please let me know everything that you're doing. So the doctor did. So that just reassures me. I don't know how you feel, everybody's different, but I do find that most doctors nowadays are accommodating, and I want to know everything that's going on. The last thing I want is to feel a poke by surprise. So I always ask, please let me know what's going to happen, and he was very detailed, and yet I was joking. I'm the kind of person that, even though I am in pain, I start joking and I start talking, and I need a sort of a convivial atmosphere. So this is what was going on. I guess I will talk a little bit more about this, but I want to mention it a couple of times. I've asked for an automatic needle to be used. This is a special gauge needle, so that it will I will have less chances of a blood patch needed. So returned back to the room, and again transport was great. I mentioned in the last video we had to stop for about 10 minutes. It felt like forever because of another patient coming in, and then the nurse was very helpful. She kept checking on me very often, wanted to know if I needed anything, kept bringing me water. I wanted water. She offered juice and ginger ale, and she wanted to bring me food and all kinds of things to make sure that I was comfortable. I just wanted just sharing this. There was a TV in the room. The room was small, but I didn't need much of anything. In my case, I basically all that I brought was my phone and earphones, so that I could read from my phone, which I like. And what I do is actually I listen to books on tape, and I meditate, and that I'm very happy with that. So I wanted to share that. I'm looking down because I wrote a couple of notes, and I don't think. The other thing they did is they asked me if they should be doing a pregnancy test, and so they do that previously. We can get into that, but I don't think this is the time. As to whether you shall need it or not, I'm talking about, and that's why I'm laughing. I'm laughing to myself. It's a inside joke, I guess. So that's basically the idea. I did not have. I did notice this. I didn't have as much contact with, or she said I didn't have contact with as many personnel as I usually do. So I think the hospital was trying to limit how many people I came in contact with, which I think it's a good thing during this time. So I hope this is helpful, and we'll do another video on yet another aspect. Keep the same outfit going. Thank you.